Good afternoon and welcome. I'm Brenda Metzler. I'm a community and program support specialist with Let's Grow Kids. And we're excited to be here together again, having a live conversation with folks from the Department of Health. And I just want to acknowledge at the top that there are anxieties when we think about transitioning back to normal, whatever is the new normal maybe. And that's understandable. I think I know that having accurate, up-to-date information is so important, and that is one of the reasons that we are so grateful to be able to have these monthly live conversations with the Vermont Department of Health. And today we have Dr. Breena Holmes, we have Margaret Tarmy, RN, and Sally Kirshner, RN, and they will be answering a lot of your questions and giving you the most up-to-date and accurate information. So welcome. Kathy, if we can go to the next slide, that would be great. Just a few housekeeping details. So for best sound quality, you are all muted. And we do welcome your questions. Some of you submitted questions ahead of time, and you will see those represented on the slides and in the presentation. We welcome questions that you haven't asked yet or that come up as folks are presenting. And please use the Q&A box so that we can capture your questions, and then during the Q&A, we'll be able to see them all in one place. So I'm going to hand it over to Dr. Holmes and Margaret and Sally. Thank you for being with us today.
Margaret, you want me to lead? How do you want to do this? You want me to go?
Take it away, Breena. Take it away.
All right.
I think.
Okay. Hi, Health Department team. Okay. Good afternoon, everyone. It has been a long time since I've been with you. I did pop in, I think, a few months ago, but even just the platform and seeing Let's Grow Kids reminds me of where we were a year ago and where we started. So I just wanted to lead with gratitude. You remain these incredible heroes in my life, the way you responded to the needs of children and families last March at a time when we had so much uncertainty. We didn't know anything about the virus, and we had tons and tons of questions and very little answers. So I'm hopeful today that you'll feel there's much more in the way of answers, but I am acknowledging that we're also in a transition, as Brenda noted. We have a lot of trouble understanding exactly how Vermont Forward is going to play out with our littlest, and I'm going to do my very best today with Sally and Margaret to take you through what we know and what we don't know. Next slide, please. Okay, by now I hope you're familiar with the Vermont Forward roadmap to reopening. This is acknowledging that we have a very important metric in Vermont that we're following, the percentage of people who are vaccinated. And at the top of each of these steps, you'll see there's a percentage for all Vermonters, but also a percentage of those eligible. And that's an important distinction. We acknowledge we're only vaccinating, starting Monday, people over 16. So we're firmly in step one. We've got 40% of people first dose have started in all of Vermont age groups. So that was why last week there was so much energy around travel, and why you probably noted that there was more conversation about what to do with your families as it related to people who are going to travel. So there's some sectors that have come into this guidance, and the quarantine is all gone for travel. You no longer have to ask. The only thing we're requiring of Vermonters is to come on back and get a test if you do travel. I will say the complication of this messaging is we really would prefer people not travel. So it's sort of a don't travel, but if you do, you don't have to quarantine, but you do have to get a test. And then as we move up, you can see maybe it's not that visible, but May 1st, we're going to allow much more sectors to come into normal business operation. There'll be some pretty clear gathering number restrictions. And as we head to June, more and more people can get together. And the ultimate goal is July 4th, there'll be enough people vaccinated in Vermont that there will be no restrictions. And at that point, masks and distancing will just be encouraged. Next slide. Want me to keep going, Margaret?
Yes.
Okay,
Yeah,
so today we're
thank
going to look a little bit about what's coming. You know, we really want guidance in your hands, and we're aware that it needs to be done carefully and to reflect where we are and where we're heading. So I have trouble anticipating this, but I'm going to say in the month of April, you will have new guidance. I just mentioned travel, but I'm going to restate it because it's super confusing. And then we'll talk a little bit about the vaccines, do some of our, I think Margaret and Sally share a lot of data with you, and then we've got your questions popped onto some slides to continue that conversation. Next slide. Okay, so pretty straightforward, and then some decisions. So the first thing that will always hold you up as some of the really important decision makers and heroes is that we can't let sick people into our programs, into our schools. This is adults and children, staff and students. We have to be really careful about this. And, you know, I will say that we learned a lot about infectious disease in general during this pandemic. And the amount of children who were sick that were floating around our centers and our schools and our staff, I think we don't want to go back to that place. So we'll spend some time as we recover from the pandemic thinking about paid sick leave and supporting families so they can be home with their children when they're sick. This is a career passion of mine, so I really look forward to amplifying your voice on that, because you've been in some pickles. You've been in some tough conversations with families who really need their child to come in, and they're not well, and you know it, and you know they need to be excluded. So in that vein, there's a big decision on the table about what to do with health checks. The schools have moved to entirely health screenings are done at home. No more temp checks, and parents are just checking in on the symptoms list of COVID and acknowledging their child is symptom-free and sending them off to school. So as always, if schools want to do a little bit more than that, they're welcome to. But from a policy perspective, we've removed them. From childcare perspective, the CDC is a little different. They do think they're still a really good idea, but they do offer the option for you to do them at home or to continue to do them in your entry point as programs. So that decision has not been made. We did meet last night with the Child Care Advisory Group, which is stood up by the Child Development Division. And, you know, we had some nice dialogue about how it works. It is cumbersome, and folks were asking to not have to wear so much of a shield and the gloves, and we looked into that today. And if you're going to do the temp check as a child care provider, you do still need to wear gloves and change them in between each child. There are a lot of programs that are having the parent do the temp check witnessed in front of the child care provider, and lots of places around the country have opted to do that at home. So always open to your feedback on that. I just told you about the travel, but I want to put it even clearer here that you no longer ask about a travel screen, but we did put out some communication yesterday with Child Development Division that if you have public pre-K dollars in your program, you really have to follow that no quarantining rule, because it's part of the state system and we don't want you making up your own rules on that. But programs that are private have your own discretion. So just to be very clear, if you want to set forth any kind of quarantine rule and you don't receive any of those public pre-K dollars, you are, you know, that is your decision. My dog loves to bark when I do webinars. It's just her little thing. Next slide, please. Okay, the good news about the virus, speaking to how little we knew 14 months ago, we really overdid the hand hygiene and the touched surface guidance. It turns out, and I'll show you a slide in a second, the CDC has studied this extensively. This virus has very minimal spread on surfaces or our hands. This is a respiratory virus. So hand hygiene is going to go right back to basic practice. No more, you know, paragraphs about every place you have to have a hand hygiene station and playgrounds, and it's all going away. We're just going to really get you back to those basic, get your kids' hands clean before and after activities and eating and moving about. I would say the mask is going to be our biggest conversation So I will just tell you, this is what it says in Vermont Forward, and we're going to continue to wonder together what this space looks like. So it's still, as you know, required for staff to wear masks in your programs, and the children have always been in that strongly recommended space, which I'm pretty proud of. And that's really a testament to your hard work. We never required it, as we did require it in the public school system. And by not requiring it, we were able to show that you all worked very hard on this and had a lot of good compliance among young people. And the developmental efforts of our children is also super admirable. They really pulled this off. After July 4th in the state of Vermont, masks are only going to be encouraged for the whole society. Now, this might be a good time for me to pause and just do this thing with my brain where this has only been 10 days. This came out Tuesday last week, and it's a very slow progression for me, even with all of my steeped energy on COVID, to imagine this world that is being forecasted by really smart people. So we have infectious disease people and epidemiologists and vaccinologists anticipating that by this critical mass of vaccinated humans in the state of Vermont in July, we are going to be in such a safe environment that we don't have to mask. But I have a lot to say, and I really want to talk with you all about what this might look like for children. But I also know that we're not going to be in a position to, as a state, put forth anything different than this. If this is what the data is allowing, then the state is going to use this word encourage. And I think how that plays out in your centers and homes is going to be of great interest. And then cleaning is still the rule of the day. Disinfecting has fallen away. So next slide. Here's what the CDC says. Based on the available epidemiologic data and studies of environmental transmission, surface transmission is not the route which SARS-CoV-2 spreads, and the risk for surfaces is low. The principal mode by which people are infected with SARS-CoV-2 is through exposure to respiratory droplets. Cleaning surfaces using soap or detergent and not disinfecting is enough to reduce the risk. And when focused on high-touch surfaces, cleaning with soap or detergent should also be enough. Pretty big change for you all, and I hope welcome. Next slide. So we have some work to do thinking about the distance. Again, the school guidance, everybody's 3 feet apart now. Doesn't matter your age, with adults still being encouraged to be 6 feet apart because it's easier to set that up. And we are aware that in Vermont Forward, the distancing falls away as well. So there'll be some stepwise, as you saw in May and in June, to think about how many people can gather and in what types of size spaces. But when it comes to July 4th, people can move about. Are they still going to be encouraged to distance? I think so, from my perspective as a pediatrician, but I did want you to know that we'll have to think about this in your physical spaces as well. I imagine that you're a good group to talk to about distancing because you gave it huge efforts, but I also know you had kids in your lap, and I know that there was, children hang with each other when they're young, and that you did as best you could with this, so it might be okay to not feel that restriction. There's a lot of talk about cohorting and mixing. So you have taught us that you needed to do that throughout the pandemic. Early in the morning, a couple different classrooms would come together for workforce reasons, and late in the day, it didn't lead to anything more than longer line lists if someone had COVID. So we now say it's okay. We've told the schools they can do it, but the schools are saying, we like keeping our little pods because there are cases. And when there are cases, it's a big pain in the neck to have 30 kids as opposed to 10. And especially when kids are running around outside or doing playground and recess, it's not easy for contact tracers to say exactly whom among them fits the clear definition. So they often say, I think that whole gang has to quarantine. And then we will talk forever about this virus, that it just doesn't do well outside, which makes us all feel better when the weather shifts and when we're able to be outside. Okay, a couple more things and then we'll get to your questions. So in the school guidance, we were, after a lot of conversation all year about the loss of not having volunteers, we've added back volunteers as long as they're vaccinated, which brings forth the kind of honor system. As you know, Vermont's not heading toward any kind of passport immunity thing where we carry an laminated card on our forehead. So the schools are opting for a very self-attestation thing where if a volunteer is coming in to do guided meditation with a great group of fourth graders, that person will stop at the office and identify himself or herself as vaccinated. This is kind of a strength-based approach to this. I recognize it's complicated. So in the childcare guidance and thinking forward about summer, we have to think together about volunteers and visitors. I'll tell you from a public health perspective, there really wouldn't be any reason to exclude them. But I also recognize that sorting out who's vaccinated, who isn't, is not, we would never ask you to do that. And we did have a good conversation last night with the Child Care Advisory Group about this. So you can see there's the temperature check health screening is on the table, and this volunteer visitor is on the table. And then we're going to have to wait it out a little bit on masks and distancing, but I'm forecasting for you they're going to be encouraged but not required. And I know those words mean a lot to you as it relates to how you set up your program. Next slide. Okay, I'm going to turn it over to Margaret and Sally to roll through some of your questions.
Okay, I'll jump in with this one. So this first question is really asking about the timeline of Vermont Forward and also the new child care guidance. So Breena just did a really nice introduction and overview of the Vermont Forward guidance and the progression of steps associated with % of people vaccinated and those eligible. So the new guidance for childcare, we do anticipate will be released by the end of April. As Breena just outlined, there's a few more things we need to close and make decisions on. And just to kind of provide a little bit more detail with the Vermont Forward guidance, there still remain to be certain sectors that have sector-specific guidance, and childcare is one, schools are another. So the guidance that is under childcare will be the guidance, and then eventually July 4th, provided everything stays on track, the Vermont Forward guidance would be the universal guidance.
Oh, and
hold on one sec, Sally. I have a question for the team.
yes.
Would you like me to answer questions as they come up live in the Q&A, or is it easier to slow that down and do it verbally at the end? What's your best? Because I can go right in and just.
That's a great question.
What do you think?
If we have time, it would be fun to hear a verbal answer.
Okay.
And we capture all of the questions. That's why we ask people to put them in the Q&A. So if we don't, we'll give a written answer. And sometimes what happens is as we go through the presentation, questions get answered and I remove them as they get answered. So we'll sort of play it by ear when we get through the ones that are on screen. Thanks, Breena.
Right, and I can just, we've talked about these questions a little bit, as Brenda just kind of said. We get to the questions some as we go through the slides. So it is being discussed about families doing the health screening at home, or Breena mentioned about the health screening done by the parent at drop-off with the child care teacher observing and making sure things are going okay. So those are some options that are still being discussed. And again, with the guidance still being prepared to come out. And again, outdoors is the safest. Luckily, we're in a bit of a drought, so there's not a lot of rain going on these days, except for today. But yeah, to use either large common areas or go outside. Again, we talked a bit about the masks and visitors at the center, if they've been vaccinated, mentioned that just to ask the person about that and not to have any real defined process of making sure that person has been vaccinated. And at the moment with our present guidance, it's still masks are required for staff and parents. And to hear what Breena was saying, it's the research showing that this virus is more readily transmissible through respiratory droplets. So everything we can do to either, depending on requirements, but encourage and set the standard that people will be wearing masks in your programs. And I'm thinking also, as this goes on, you guys have been for the last year teaching children how to wear masks. And when they were maybe too young a year ago at this time, they may be old enough now. And because they've spent so much time being in your care, as you folks encourage them to wear them and train them to wear them, then as they go on, maybe to pre-K or to kindergarten, they're comfortable with the mask. So that's a kind of an important role you folks have.
Yeah, Sally, can I just interrupt for a sec? Oh dear, so sorry. So I do want to be very clear on something though. If it's safe for us to not be masked, that's going to be kind of a universal guidance. So
Okay.
I want to sort of socialize an idea with you all right now that I'm having some scientific pathway across my brain with. I'm slowing down and listening to the health commissioner and Dr. Patsy Kelso and understanding that they're trying to tell us that it will be safe in the summer, but that we may choose, there'll be a lot more personal responsibility, like what do we choose to do as a citizen? So I just want to acknowledge this strange space we find ourselves. What will be the masking situation of Vermonters in the summer? It's going to be encouraged. So what word do you use and how does our guidance play out? I just need us to be prepared for the fact that it's not going to be a mandate. So it's going to be more of a gray zone that we're going to have to spend some time with together because it's going to feel weird. And I had to just say that, Sally, because you're right, but I don't think getting kids ready to go to school and, we may not even be masking kids in school next fall. I don't know what to say about all that. It's important we stay in the gray.
Okay, that's a good point. So, okay, so on to the next slide. And Margaret, I see you're pinging for this one. But it's
Apologies.
more of the same discussion.
Yeah, so we got a lot of questions that were similar and just really wanted to make sure we were really thorough. There's a lot of changing information, a lot of questions. So, this one is really, again, addressing about the mask guidelines for early childhood centers when the mask mandate is lifted. So, just a real quick summary then, again, that current guidance as it stands is that masks are required for staff and adults, strongly encouraged for children, and that after July 4th, they will be encouraged. It's going to be a process and certainly a shift in what we've experienced over this past year. The next question is, once we're fully vaccinated, is there anything we can drop from our intensive cleaning routines? So we did answer that piece, that it's anticipated that with the revised guidance that's hopefully coming at the end of April, that we are going to be reverting to just basic infection control practices. So just routine cleaning and disinfection as appropriate. And that will be sort of getting back to your previous infection control practices, which should be a big lightening to your load, and just certainly great that that step is likely to be forthcoming with the new guidance in the end of April. So I think the second question is really getting at, once we are fully vaccinated, do the adults still have to wear masks? So again, at this time, the guidance is anticipated that staff and adults are still going to be wearing masks. This is going to be the sector guidance for childcare, and that eventually as things progress and we are in this post July 4th climate, that masks will be encouraged and the Vermont Forward guidance will apply to this sector. Just wanted to reinforce this question. We definitely still get questions about numbers in a pod, and just wanted to answer this in this forum and say that currently there's no limit to pod size or mixing of pods, and this is based upon Vermont's experience to date that mixing of groups is permissible. Really, the key is continuing those attendance records.
So, and again, this is the anticipated thinking for the guidance on cleaning and disinfecting, as Breena set the stage earlier, that again, it's a respiratory spread, and that just now the cleaning practices as said in the caring for our children, we're going back to that and not the extra, regular disinfecting and the other practices that we've been following for the last year. So it's, and said here, the blankets and soft toys as to be laundered according to caring for our children. So kind of going back to those practices. And next slide. On travel, and yes, as we've been hearing from the governor, and as Breena said, this is hard to think about, but as you come back into the state to get tested, unvaccinated Vermonters must be tested within 3 days of returning to Vermont. Some people are saying it has to be on day 3, on the 3rd day. It's just within the first 3 days is what this is saying. You don't have to wait 2 days and then do it. And again, if though maybe tempting or hard to get out of what we're doing now, but Breena mentioned about the public pre-K dollars. Those programs need to follow the governor's travel guidance.
Yeah, Sally, let me just embellish a bit.
Yes.
Oh, why does that happen when I talk? So folks, I think we got very sensitized that travel was bad. And we were really tuned into a travel map last spring, winter, summer, winter, fall, about red zones and green Vermont. We were doing beautifully. We had so few cases that you couldn't travel. There were all these rules. And if you did travel, you had to quarantine. It's very important for us to acknowledge that we have more cases in Vermont than in other parts of New England. So that heightened awareness that we shouldn't be traveling, it's actually gone away, and we have to shift our thinking. If you travel safely, there's no risk or low risk. So it's a important message that the state has lifted this. We were one of the last states to have any kind of quarantine and travel, and it doesn't make sense anymore. So I just wanted to make sure, this is grounded in really good science. This isn't some loosening up of something. But it is a shift for us. And I see in the chat, so I'll just address it right now, my sweet dog, that you will have some autonomy to impose a different rule for your families, but I would just caution you, we don't like to come outside of public health thinking and recommendations, and the current best public health thinking is you don't have to quarantine when you travel. So it's a
Yeah, and that's domestic
private
travel.
provider has autonomy. Yeah. And this is only domestic travel. That's very important. We do still follow the CDC guidelines for international travel. I'm letting my dog out. Keep going, Sally.
Just wanted to ask one point of clarification. So a family travels and they get the test within 3 days. They're following all the protocols. They don't have to quarantine and they can just show up and bring their kid, correct?
That is correct.
Yeah.
Thank you.
Yeah, and they can technically come back, you know, before they have the test. So if they have the test on the 3rd day after returning, but they're in their day 1 and day 2, and I think that's what Breena's trying to get us to think about that, because that's really different. We're still, I mean, I'm still figuring that out. So there it is.
I guess may I slide in one more question that's related to that? There's a lot of, I think there's so many technicalities. And like you said, Dr. Holmes, we're trying to figure out the details. And so if unvaccinated people do not get tested, do they quarantine instead of testing?
Yeah, there's no provision for that. It's an honor system. Come back, get tested. And there is no policy on what to do if they don't. So it's a funny but important, we want people to think twice before they travel. And then when they do travel, we want them to come back and get a test. So we're moving into this personal responsibility place that's pretty important for public health, right? I mean, that's our lane with please make good, healthy choices for yourself and those around you.
I think this is one of the places where the anxiety rises because we want to trust our families and we want to honor the safety of our program and the kids and ourselves and our staff. And so it's that tricky place.
Yeah, I can add a few more points. 5% of the cases in Vermont since the beginning have been associated with travel. So it's 95% have not. So that doesn't mean if you get a case from someone who traveled, it's not going to completely throw you, but it's only been 5% of the travel, and that's during, time when case rates were higher in the surrounding states. So, and a good solid 50% of cases in Vermont are household contacts of people with COVID, right? So there's still like this density to the data. Is this you, Margaret?
I'll jump in here and ask you to chime in as well, Breena. We really just wanted to provide a brief update on our vaccine update and just say I'm so delighted that since we met with you last that you've been able to get your vaccine. And so next up is we're presently doing our 30 and up this week, and then next week it'll be 16 and older. This grid here in the middle is really representing the percent progress with vaccination by county, which I thought might be of interest. And then this is from our website about the data dashboard as far as the people that have received 1 shot and the people that are completed with their pseudo series. You all probably are very well aware that there has been a pause on the Johnson & Johnson vaccine. And Breena, I'm just wondering if you want to add a few talking points about that.
Sure. So there are 6 people in this country out of over 6 million who received the Johnson & Johnson that had unusual placement of blood clots. It wasn't so much that they had a blood clot, it was where the blood clots were. And this process in the US for adverse event reporting worked in this circumstance. So they paused it the second they saw what they call a signal, which is this notation that a couple of people appeared to have a similar side effect. So to me, and of course I am a pediatrician, so I'm very steeped in vaccinology. To me, this is the system capturing and pausing exactly how it's supposed to. And I fully anticipate that within a week or so, the Johnson & Johnson vaccine will be back being utilized, but there may be some parameters around it. All of the people with the side effect were female. And as most of you know, when women are at different phases of their reproductive life as it relates to endocrinology, they do have higher rates of clotting risk based on estrogen. So that doesn't necessarily mean estrogen you take. It can be just your own inherent estrogen. So the fact that all 6 were female is of interest to clotting people. But the state's doing a really nice job. They're rescheduling actively all the people who had been scheduled for Johnson & Johnson. And it was only a few, I think 4,000 doses in the next few weeks. It's the lowest of the volume of the 3 vaccines. So it's a slight blip, and but I expect we'll be moving forward shortly. And that while I'm remembering to say this, because vaccine and testing, those 2 things are linked in my brain. I just was in a meeting with Dr. Levine where, we continued today, we had 170 cases, but we are exponentially testing more people than anywhere else in the country. So the South has essentially stopped testing people. And even if you look at the graph of test volume, New England states are lower than Vermont. And so you always have to put the number of cases we find in the context of how many people we're testing. And if you stop testing, you're not going to find any cases. So it's not a good time to be comparing our numbers, raw numbers, to other states, in case that you guys track the website every day the way I do. I wasn't sure if that was well known to people. We're still testing like crazy, which is great. That's exactly what we should be doing.
I guess the other thing, that I just wanted to mention is just to kind of give you all a frame that having 50% of our population vaccinated, and Breena, feel free to chime in, is really going to, or at least in other countries in Israel, been a real tipping point. So this part on the right-hand slide really talks about almost 50% have had 1 dose, and obviously that's not fully vaccinated, but we are at 32% of our population having completed this series. So we are getting very close, and we'll be getting very close to that as the weeks progress, which will really have an impact. I'll chime in here. Really wanted to just present some recent data. This is from our weekly data spotlights that we get and are on our website. We certainly at the School and Child Care branch have received lots of calls about just concern with the prevalence of the new variant and cases in children. And so just thought it would be time well spent to just show some recent data regarding the distribution of cases by age group. Certainly the recent data is showing that the most amount of cases are in our young cohort, our 20 to 29, but just really wanted to emphasize that still in your population that you're caring for is just a very small percentage. So this is continuing to really tell us that this age group of 0 to 9 is still at a very low rate of getting COVID. This is just another breakdown of this. This is on the upper left-hand corner talking about the rate of COVID in these 2 distinct age groups. So just really trying to provide a little bit more data about the rates and how they compare with the age distribution, and the 0 to 9 population being at a much lower rate compared to other age groups. I don't know if you want to add anything, Breena, about children or anything.
No, I just appreciate data. So if there's something specific that you're curious about, over time, we've been breaking this down over time between, we can break it down to 0 to 5 as well, but we haven't done that in a while. Our data team is really stretched, so we don't ask them too often, but it's always good to hear from you what would be of value. I've observed over the year that if you've had cases in your program, it doesn't really matter what the state rate is, right? Because once you've experienced a couple cases, that's your experience. So having state people tell you that it's a low prevalence doesn't really matter. So I'm just acknowledging that.
Sally, do you want to take these?
Yeah, sorry. Yeah. So this question about the parent who's a teacher and is quarantining, assuming from a exposure at the school where she is teaching, should stay home and not pick up her children from the childcare. And then you guys have been involved in these conversations about how, if she is able to quarantine at home away from her child, maybe she can, maybe she can't. And then a lot of times that's when we work with the family to see the best way to honor the quarantine and mitigate any risk of passing the virus between their family. So that one is kind of how we've been working things up till now. And I think that's how it'll be as long as as we continue to get positive cases in children, though we hope that will be not very often over the next many months. And then there's a question about people who test positive can retest in 7 days. It's still a pretty good discussion on our website about if you test positive, it's 10 days in isolation, and then some further instructions for if you're positive and you have symptoms, or you're positive and you don't have symptoms, but the 10 days and the symptoms are gone, and of course also close coordination with the physician or healthcare provider to determine the best time for the person to come out of isolation. So Margaret put in some other text here, and that's kind of an overview for here. And the next slide, a few other questions yet.
So this question, is what guidance do you have for programs with the state opening up and children not being vaccinated? We still feel very vulnerable, and one COVID person could close down our entire program. So first and foremost, I just want to recognize that, the shift and the reopening, and, certainly the children that you're caring for not being able to be vaccinated yet is a huge change. And, with the anticipated change guidance, there is certainly still going to be a spread of mitigation factors, so yes, to be determined whether or not health screenings are going to occur at the facility or at home. Definitely need to have people stay home if they're sick. We've talked about how masks will continue to be required for staff until the adult fourth timeline, when Vermont Forward is in effect. Hand washing is key, so we're going back to the basics here: hand washing and routine cleaning and disinfecting. And we've talked as well about physically distancing as safeguards as much as possible. So just want to recognize that that there's a lot of feelings out here with certainly your population that you're going to be caring for not being vaccinated. Again, we're moving towards this recovery phase, and more adults will be vaccinated, and over time, hopefully this will feel a little different than it might right now. There's another question on here about running an overnight residential camp, and when might we have some guidance associated with that? And Breena, I don't know if you have any more specific updates, but it's coming very soon.
Yep. So overnight camp is actually, the guidance comes from the Agency of Commerce and Community Development, which, as opposed to childcare, which comes out of the Department of Health. So I am working with Vermont Camp Association and ACCD, and we have a meeting today at 4, and we hope to have a final draft to the restart team at the governor's office early next week. So you should get, we say this in every meeting, that April is our goal for all of the guidance to come out. And I think we're ready for question and answer. Brenda, would you like me to just start going through this? Because I've become quite skilled at chat boxes.
Yes, thank you.
Okay, so folks, we're going to dive in here, and what we can't get to, we're going to answer in a different way. Jenny wants to know if parents can come to the program. So the new guidance is, we're grappling with that right now, but I will just predict for you that visitors and volunteers are going to be welcome soon, and thinking about how to state that in the guidance around whether they're vaccinated or not is complicated. So I do just want to acknowledge that, because of the reasons I said earlier. Are we going to sort of require people to tell us if they've been vaccinated, or are we just going to wait till the summer when, you know, you make a statistical assumption that most people are, and people are welcome back as visitors? Emily's noting concern that masks are only being recommended. I hear you. We will have a very close to herd immunity by summer if all continues. We'll be in that, 80% of people who are eligible should be vaccinated by July. And we're also very lucky in Vermont that we don't have a lot of vaccine hesitancy. So when we're talking about, percentage of people accepting the vaccine when offered, it's very high. Ariel wants to know if we are a public pre-K partner. Does not asking about travel apply to staff too? Yes. So anybody that's funded by the state should not be asking anyone about travel, staff or students. Jenny's asking about food. So we work very closely with the food service people at the Agency of Education, awesome Rosie Kruger. She is allowing, and we started to allow this in schools, that you can have food come in from home. We just have some parameters around how it's served. So that's exciting. And Kara's noting, while we wait for official guidance, can we start mixing? So Kara, what we said last night, and I have to hold myself to this, is we needed, the guidance that is currently in place has to stay in place until there's the new guidance. So it's not so much waiting for the governor, it's waiting for Breena and Elisa, the MCH director, and Crystal Michaud, everybody to just organize it up, get some final decisions made, and get it into the hyperlink, which I really do think will be within 10 days. I'm really hopeful it's even, well, I shouldn't say that, 10 days. Jenny, field trips are allowed, and the parameters around those are just follow the guidance. I will tell you, one of the most discrepant places of guidance right now is what to do about vans, because we have good school bus guidance, but vans are really treated more like a private car. And our environmental health folks are aware you don't want too many kids in a van, but as we move toward this more vaccinated people, less virus summer, there might be opportunities. So if you need vans for your field trips, we're going to have to watch and wait a little together. Meg's asking if school programs are supposed to follow both AOE and CDD, what should they be following right now with the guidance conflicts like temp check? Yeah, I would say that I get this question a lot. It's kind of a muddy pond. I don't think there's a right answer. So if you want to give up temp checks and follow the school guidance, you will not be penalized from my perspective. I can confirm that with CDD. Beth's asking, when will we be allowed to have families enter the building? I think I just answered that, but at the very latest would be July, and there may be something in the guidance that allows for that to occur sooner, recognizing that I'm not sure how you're going to attest people's vaccine status. Claire Kendall. Hi, Claire. Claire wants to know whether there'll be revisions to staff illness exclusion policy for fully vaccinated staff. You know, we're standing pretty firm, Claire, that even symptoms after the vaccine, you need to stay home. So again, strange spot. If someone just has a little drippy nose, are you really going to keep them home? And I just want to answer this like straight up medically, that because we do have some people break through the vaccine, and we're saying runny noses should stay home anyway, that you shouldn't wiggle on the exclusion policy, at least for now. The breakthrough on the vaccine, by the way, is extremely rare, but it occurs, and it was expected to occur. Remember, because first of all, these vaccines are among the most effective in the history of vaccines in this country, but they're not 100%. But the cool part about these vaccines is they protect against severe illness and death. So just because you hear in the news someone breaks through and tests positive for COVID after a vaccine, they're not ill in the vast majority. Okay, Lisa's asking, will families be allowed to drop off and pick up? Yeah, this came up a lot last night as well with the advisory group. We're moving toward this, but there's an important space. You guys have set up these really well-organized settings with staggered drop-off and these temperature checks and really setting expectations. And some of the folks last night were saying, gosh, I kind of wish this was a September start, because you've got routines with families that really have been established now for a year. So I just wanted to acknowledge that you could certainly, the guidance is going to say most likely that all of that goes away. You can just do what you used to do, but I don't want you to feel like it's a mandate that you shift on a dime. Laurel's asking, we are an AOE partnered program. However, our infants and toddlers are not funded. Would it be true that we do not have to follow the travel guidance of those children? And as a private provider, in addition, our contracts with the school district end in June. Does that mean we're not partnered until we sign new contracts? I would say this type of complex situation, you should talk to your CDD, your child development licensor. But again, I just really stand by, you don't have to quarantine when you travel. So if you really want people to quarantine when they travel, then you're going to need to check in with regulators on whether you're out of alignment with the state requirement there, because the way you're funded and all that is not my wheelhouse. Ruth wants to know, can a simple timeline of when each guidance item changes be provided? So Ruth, they'll all change at once when the guidance becomes live within the next 2 weeks, all at once. And I think another great promise we could make to you is we will have a highlight document that shows where and what's changed. But what you're going to be pretty surprised by is the size of the document is going to shrink significantly. So the school guidance went from 40 to 18 pages because of this, you know, so much of it can be linked to sort of regular cool stuff like HVAC system, you know, in the school systems or food services. And then so much of it was about cleaning and disinfecting, and it's really going to fade away. Bethany stepped away and is wondering if we answered the soft toy and dress up allowed. So yes, Bethany, I mean, they're still not our preferred surface for infectious disease in general, but they are welcome back. They will be welcome back when we get this guidance to you. It will be, there'll be some cleaning requirements, and just a reminder that they do spread other viruses. Tiffany's noting that parents have been very upset when children are sent home for runny noses. Will there be updated guidance? Tiffany, you would not believe how often we talk about runny noses as a team. I can't find the pathway here, and I can't figure out why we would want kids with runny noses in school or childcare. I know parents are upset. I would rather work on social policies so parents can stay home when their kids have a runny nose. But I think you can, what we've been talking about as a group, a COVID silver lining, we want more health and safety guidance for you guys. We want maternal and child health nurses that you can grapple with this stuff with, because this needs a team. We got to get your medical providers in your community to say, this is Johnny. He always runs his nose in April. It's clearly not anything that anybody is going to catch from him. You know, that kind of team-based care and I don't know what to do about it because it is a symptom of COVID. So why would we allow it in? But I'm oversimplifying, and I know it puts you in a terrible position because parents don't have choices and they need their kids to go to care. So I have no answer, but I really continue to exclude, and we will continue to try to figure it out. Is there data about whether or not vaccines prevent long COVID, or is it too early to know? That is a great question. I do not know. But it definitely prevents severe disease, and I would define long COVID as severe, but I will check on that. If we are to follow the current licensing travel COVID guidance and an unvaccinated parent travels without their child and can't quarantine from their children because of the new travel, no quarantine, when can their child return? So Amy, this is a classic example of a question that can't be answered because we start with no one needs to quarantine. So if you're making a decision as a center or a program that you're going to quarantine, then public health can't help parse this for you because no one needed to quarantine. And then trying to decide if someone does when we already said they don't has no answer. I hope that's helpful. I know what you're trying to say there, but there is no basis, public health basis to quarantine anymore. So the decision to do it would be too complicated. Bambi wants to know if teething or allergy already knows what's the best recommended advice. It is such a struggle. I hear you. I really hope you have pediatric providers in your community that can help you. And in a perfect world, we're starting to see much better teams in communities between school nurses and our medical homes, and I hope you're a part of those teams as well. And I actually have offered before, our team has offered this as well, that if you really have a community where the providers are not accessible to you and you don't have relationships with pediatricians, we can support that. I really would like to help. And the last question, can we remove the temporary fencing between outside play to promote 6 feet? Yeah. Again, when this guidance comes out, you're going to be able to set up your spaces a little differently, and outside even more so. Okay, I will stop there.
Wow. Team Department of Health, your timing is impeccable. We have 2 minutes, and I'm just going to remind folks, thank you so much for answering all of the questions today, all of the ones that came beforehand and also the ones that came in live. I want to remind everyone that a recording of this conversation along with all of these slides will be posted on the LGK COVID resources page. And that will happen as soon as we can after this is over. And also just know that sometimes folks want to, try to click on the links while the presentation is happening, and they actually don't they're not live during the presentation, but they are live in the slides. So if you wanted to click on any of those live links, then you'll be able to do that when you find the slides at LGK. And also, the Department of Health reminds us every time that they are there for you. They are available. They are happy to answer questions. They have a school and childcare warm line. They have an 802 leave a message anytime line. Those numbers are, and the times that they're, someone will be present when you call, are posted on the last slide in the slide deck. And there's a toll-free number, 800-464-4343, where you can get any other questions that come up answered for you. And is there anything else, any parting wisdom or encouragement that any of you from the Department of Health would like to impart to us?
I just saw Ruth had one last comment, but I did something wrong with it, that she is interested in talking about that partnership with pediatric providers. So can you let Ruth know my email? I tried to type it in, but the Q&A went crazy. So
I will, I know Ruth, so I will share your email with
right.
Ruth. Yes, thank you. Thanks everyone for participating. Thank you, Dr. Holmes. Thank you, Sally. Thank you, Margaret. Thank you, Kathy. And thanks to all of you who show up to get the most accurate and current information from the Department of Health. I hope you have a wonderful rest of your April day.
Thank you.
Thank you, everyone. This has been great.